As you can see, the red, and it still hurts. Hi everyone, Leodine here and welcome back to my channel. So how are you guys? I hope you're doing fine and safe, keeping your face mask on when going out and still practicing social distancing. So the new COVID-19 vaccine has finally arrived. A small part of the world's population has already been vaccinated, but we still have a long way to go. As we all know that 70% of the population needs to be vaccinated to have that herd immunity. Today's vlog, I will share my experience and some knowledge regarding this new COVID-19 vaccine. Disclaimer, I am not a professional, but I did my research and my work shared a webinar regarding this. Always consult your doctor first if you decide to get the vaccine. Let's get into it and keep on watching. We all know this new COVID-19 vaccine made by Pfizer and Moderna was approved by emergency use last month. Both vaccines use mRNA, a technology that takes advantage to make the process that our body uses in making proteins and create an immune response to the coronavirus. There are other vaccines that we heard, but they are not approved yet. So a lot of us is curious, how do this mRNA vaccine works? Basically, they take a little piece of messenger RNA, which is the template in making protein that our body needs, and they put it in a globe of oil to make it stable and help to get in our body. And that's what in the injection. When it goes inside our body, that little template that our cell can read goes inside our cell. And the ribosome, which is the machine that makes protein in our cell, reads it and spit out the protein. Like all vaccine, this COVID-19 mRNA vaccine has been tested for safety before being authorized. It is new but not unknown. It has been studied for more than a decade. mRNA vaccines do not contain a live virus and does not carry a risk of causing disease. 2 doses were 95% effective in preventing COVID disease. There's this graph from Pfizer that shows up to 120 days. So we don't know yet if we're still going to be protected from COVID for a year or 2 years. But they do know that in this amount of time, we are protected. So who can receive this vaccine? Approved for adults age of 16 for Pfizer and 18 for Moderna. For children, they are still on clinical trial. People who have underlying medical condition will have the same safety and efficacy results, same with healthier people. For those who had COVID, they can still receive the vaccine once recovered. American Academy of Obstetrics and Gynecology recommends that pregnant and lactating moms are free to make their own decision on getting the vaccine, of course with the consult of their care team. They believe it is safe based on science, but it has not been studied yet. So how are these vaccines given? It has 2 doses. 1 dose is on day 0, and for the next one on 28 days for Moderna and 21 days for Pfizer. Both those are necessary for protection. So how are these vaccines given? It has 2 doses. So question is, can you get Pfizer vaccine for the first dose and Moderna vaccine for the second dose? Well, the answer is no, because they are studied differently. They are not interchangeable, like you can get one and then another vaccine for the second dose. You have to stick with the brand you started, and it should be given alone, like at least 14 days before or after you have any other vaccine. What do I feel or experience after given the vaccine? Both of the vaccine produce a strong immune response, which is a good thing because it's working. But yes, it also produces inflammation like sore arm, fatigue, body aches, and headaches. Well, those are the common symptoms. Fever is not common on the first dose, but on the second dose, low fever may occur. And mostly symptoms may be mild or moderate within the first 3 days. Vaccines does not give you colds. COVID does. So if you have runny nose, sore throat, and cough, maybe you have COVID and it's not from the vaccine. Before I had my first COVID vaccine dose, I have the option if I want to get tested. Since we are still at the peak of this pandemic, a lot of people who came in to get vaccinated might actually have a COVID and get sick on the next day. If you experience those COVID symptoms, do not ignore it, especially when you just get your vaccine. But if it's just arm soreness, body aches, muscle pain, just give it a few days to recover. And if you do have allergies, you must talk to your doctor first before getting the vaccine. Another question is, can we stop wearing face masks after getting vaccinated? Well, me personally, I don't want to stop wearing face masks yet, even though I already got the first dose of a vaccine, especially just first dose of vaccine. It's not like a superpower is that, oh, I can get sick because I already got vaccinated. The COVID vaccine is 95% effective in preventing symptomatic COVID-19 disease. However, we still don't know if vaccinated people can still have a symptomatic infection and spread the virus to others. So we must still continue following safety precautions like wearing a face mask and keeping distance. It may really take some time before we can stop those safety precautions. All of us deserve this new COVID-19 vaccine. That's why the state or the country needed to have a plan to prioritize or where to start. For example, here in San Diego, we have 3 phases on how to distribute this vaccine. As of now, we are at phase 1A, which are the health personnel, employees, and residents of a home care facility. And phase 1A have 3 tier. Tier 1 will be the people who works at the hospital, seeing COVID patients at the ICU every day, and everybody in that setting, as well as the people at the nursing and correctional facilities. Tier 2 is the next priority category, which are the primary care clinics like the company I work for. But since I'm at the office department, I belong to Tier 3, specialty clinics, laboratories, dental clinics, and phase 1B is for essential workers like education sector, food industry, first responders like police, firefighters, correction officers, and transportation. Phase 1C is for adults with high-risk medical condition and adults over 65 years of age. Phase 2 is for children and young adults, and phase 3 is for everyone else living in the US. As for the new strain of this COVID-19, one of our physicians, an infectious disease specialist, she explains that right now, this vaccine will work against this new strain of COVID. No one is required to receive the vaccine, but all of our physicians recommend on getting one. And again, ask your doctor first. It's my 2nd day since I got vaccinated, and I haven't feel anything like fatigue, muscle pain, or body pain, headaches. But my arms is still sore, as you can see the red, and it hurts just like getting your tetanus or MMR shot. But I do have co-workers that had fever after getting the vaccine. So getting the vaccine is just like split seconds. They're just gonna poke you and you're done. But we stayed at the clinic 15 minutes after we got the vaccine to check if we have allergic reactions. So I waited 15 minutes, and fortunately, as you can see, I don't have any allergic reaction to this vaccine. And after we got vaccinated, they gave us this flyer. It's like an app. It's a part of a CDC program wherein you can check in yourself after you got vaccinated. You can tell on the app if you did have any allergic reaction from the vaccine, and then someone from the CDC will contact you, depending on your answer, will contact you to check on you. And this app also send a notification to you when or if you need your 2nd dose of this vaccine. But not just allergic reaction, but also other adverse effect of this vaccine. So that's it for today's vlog. I do hope that you like this video and I help you in some way by sharing my experience on getting this new COVID-19 vaccine. And I also hope that in time, every one of us will get this vaccine and this pandemic will end. Please give it a thumbs up and don't forget to subscribe on my channel. So see you in my next vlog.